very much. Hello, everyone. And I think it's good afternoon for most of us who are online. So thank you for that introduction. So I'm going to present a quite a significant practice transformation program that I led when I was a professor of nursing and the chief nurse at the Christie Hospital, which is a major cancer comprehensive hospital in the north of England. So it's really a very high level overview of that transformation program. I don't have time to go into the specifics of the data analysis that we're doing, but we do have publications that you can go and look at yourself for that. So just to show you where the Christie Hospital is, this is a picture of the northwest of England. It's probably a population of getting close to 3.5 million people now, and the Christie is where that heart is, almost in the middle of the northwest. That's where the Christie is, and that's the main cancer treatment hospital for the entire northwest, and we also take referrals from around the country as well for specialist services. So you can see where the hospital is covering a wide range of geographical areas. It's a big part of the country, and we do have satellite clinics and satellite hospitals across the northwest of England, but the Christie is the main hospital that coordinates and delivers all of that care. So you can see there that 95% of the care that's delivered through the Christie Hospital is actually in outpatients and in patients' home. It's ambulatory. So that's why the e-PROMs program is such an important innovation that we did at the Christie, and we started about 5 years ago. And obviously I've passed that leadership on to a well-trusted colleague, Professor Favour Finn, now, but I'm still heavily involved. I've only been in Hong Kong for 8 weeks, so you know, you can't just drop something so big like this, can you? And delighted to still be working alongside that team. So I'm sure we probably all know what a patient-reported outcome is, but I think it's just really important to emphasise that it's the report of health status, symptoms, experience, whole range of quality of life and different impacts that disease and cancer treatment or any treatment can have on a patient. But the importance is that that information is coming from the patient itself, and it's not interpreted by us. It's not interpreted by clinicians, the doctors or the nurses. We take that information and we record it as the patient perceives and reports that themselves. So in oncology, I'm focusing on cancer care here because that's what the Christie Hospital is. PROMs have become, you know, in the last decade or so, a really important part of patient care, and of course research as well, because people are living longer with cancer now, which is really great, but they're also living with the consequences of cancer treatment, both radiotherapy and chemotherapy, and survival also comes with quite a high disease burden for some treatment pathways because of the consequences of treatment. But no other hospital in the UK has really implemented e-PROMs into clinical practice. It's still very much part of research agendas, or perhaps different small clinical groups giving patients paper copies of questionnaires to complete when they come into the clinic. But what's really important about a patient-reported outcome program is that it is one way of really testing if you've got true patient-centered care. It can improve communication between the patient and between the clinician, and it provides that ongoing monitoring of patient symptoms and quality of life, so you can direct care appropriately and be more responsive to patients' needs. And of course, patient-reported outcomes really do provide the true story of what's going on with an individual patient. And this is a real seminal paper published by Bash in the States quite some time ago now. But this really demonstrated that this is in cancer oncology patients, with patients reporting themselves on chemotherapy-related toxicities. And what this study did was that it compared the clinicians' reports to the patient reports. And you can see that across all of these really important serious consequences of toxicity, acute toxicity, patients consistently scored themselves much higher for the severity of symptoms than what the clinicians did. So we like to think that we get it right. This was a mixed cohort of doctors and nurses, but there is research to say that nurses are a bit better than doctors estimating patients' experiences of symptoms. But this just really demonstrates why it's so important that we get this information from patients themselves. So e-PROMs, what's the evidence base? Why is it important to routinely monitor patients' experience of symptoms when they are receiving cancer treatment? And again, this is a seminal paper by Bash in the States. It states again, where they compared patients who were completing e-PROMs, so based on symptom toxicity in patients receiving chemotherapy, compared to patients who just received usual care. And you can see that for those patients who are reporting their symptoms remotely, and then that was being recorded into the electronic patient records for the staff to go in and to have a look at patient symptoms, they were being acted on much more quickly and timely and efficiently than what the usual care patient were. And we saw significant increase in survival. More patients receiving e-PROMs were more likely to complete their treatment pathway. There were less visits to emergency departments and an increase in quality of life. So e-PROMs can have a benefit for patient care, patient clinical outcomes, but as also to improve efficiencies of the hospital and potentially save money. And this is just another paper as well, demonstrating a very similar scenario. Patients would complete the e-PROMs remotely. That data would come into the patient's record for the clinicians to review, usually a nurse, and they could act on those symptoms that were concerning more timely and more appropriately. And again, you can see that there was a real decrease in the risk of death in the patients that were in the e-PROM program. So at the Christie, we picked up all of this evidence. We're just in the process of getting a systematic review published at the moment, and thought, well, rather than doing yet another randomized controlled trial, let's be brave enough and set this system up ourselves, and let's just start implementing this into clinical practice. So as I said, this has been about 4.5 years now that the Christie have been doing this, and we're now live in more than 30 different cancer disease groups across radiotherapy and chemotherapy and concurrent chemoradiotherapy. We've had more than 16,000 individual patients return e-PROMs to us as part of their routine care, which equates to coming up now to nearly 50,000 PROMs that have been completed and sitting in the electronic database. So this is a significant amount of information that we now have about all of these patients that we just did not have before. And that's really exciting for when we're looking at doing some real world data analysis. But I want to be very clear that this program was absolutely set up to improve an impact on direct patient care. And that's how we got the real buy-in from patients as well. They're not just providing this data through research or through an audit. It was to impact on their conversations with their clinics, with their consultants in the clinic, and to improve their clinical outcomes. So just to demonstrate this is a patient story. This was in the very earlier days when we started e-PROMs. Patient with non-small cell cancer had a significant increase from completing an e-PROM one day to then completing it a month later, a couple of weeks later. And this was after they had received radiotherapy the month prior. So they were at risk of potentially developing a PE. This was picked up by the clinician. They called the patient and said, look, I've just looked at your e-PROM. I can see you've had a significant increase in breathlessness. Tell me a bit more about what's going on. They sent the patient for a scan. They had found to have a PE and they were treated. Now, usually what happens is that patients will genuinely sit at home and put up with an increase in symptoms because they don't want to bother busy clinicians, and he would have waited for his next clinical appointment, which was a week later, and something drastic might have happened within that time. This is another example from a consultant, a physician's clinic, where he had a really good relationship with this particular patient. They discussed a lot of things, but the patient had never described that they felt anxious or depressed. But that came through the e-PROM, and the doctor went in to look at the e-PROM before the patient was due to come in to a routine clinic, noticed that the patient had severe anxiety and depression, and they were able to then engage with that conversation with the patient when they came in for the consultation, and had already preempted that they would need psych-oncology to come and see the patient on that day so they could start some therapy. So what does it look like? So the system that e-PROM sits in is called My Christie, My Health. So it's not an app. This is a web-based system, and it's directly linked to the hospital electronic patient records, which is quite a remarkable achievement. So the patient will receive a text message 3 days before they're due to come into a clinic appointment. So the e-PROM is automatically linked to the clinic that the patient is coming into. It links to the type of cancer that they have, and it will automatically link to the treatment that they're receiving. Because if they're on chemotherapy or radiotherapy, they will receive a different set of e-PROM questions relevant to that treatment. If it's a lung cancer patient compared to a breast cancer patient, they will also receive a different set of questions related to that underlying disease group. So the patient just needs to enter their last name, date of birth, and their postcode. We've tried to keep it as simple as possible. There's no passwords that the patient needs to try and remember. Then they'll go into the e-PROM questions, and you can see there that the third screen there is a question for head and neck patients about if they've had any pain in their head, face, throat, or neck. If they say yes, then a drop-down menu will come and they can rate the severity of that symptom. If they've got a feeding tube, this is what the nurses really wanted added to the questions for head and neck patients, that if they've got a feeding tube and they say yes, then they will get asked another set of questions about how they're managing that, and does a nurse need to be there at the clinic to come in and troubleshoot some of their issues with the feeding tube. So again, it's a really good way to preempt the issues that the patient might be coming into the outpatient appointment with. And this is just another example of a list of questions. But what's really exciting is that the digital team were also able to put pictures in as well to help patients rate their different symptoms. Again, this is focusing on head and neck. You can see we can ask patients to choose what picture represents the food that they're currently eating, and if they're having trouble swallowing with any of those foods. So the one questionnaire that we do have standard across all the disease groups is the EQ5D. It's a short quality of life questionnaire. There's 5 items, and it will enable us to do health economics across the different disease groups as well. And we can also monitor the colour of patients' urine for hydration. So the patient completes all of that, and then they press submit, and then depending on the severity of the symptoms that they have reported, they will then receive a message saying this is a really urgent symptom, you need to call an ambulance, right down to there's no real concern here, keep doing what you're doing, or here's a link to some health self-help resources that you might find useful. So our program, I have to stop saying our program because I'm not there anymore. The Christie program, I've already explained that we have the hospital-wide rollout, which is a general text message that gets sent to patients 3 days before the clinic to preempt the consultation. We also have a work stream that now, if patients are due to come in for an appointment and they report that they have no problems, they will then receive a text message and say, we can see that you don't have any symptoms of concern. Do you want to cancel your appointment? So they don't then actually need to come in, or do you want to have a telephone call with a nurse? And we're testing that in breast cancer patients in a particular treatment pathway. We've also just launched in the last couple of weeks a responsive e-PROM service. So similar to those RCTs that I described, where the Christie has a 24-hour, 7-day-a-week hotline, where any patients who are experiencing symptoms can contact the Christie hotline, and a Christie nurse will take that call and do an assessment. So what this program is doing is that instead of calling the hotline cold, the patient completes the e-PROM. It automatically goes up to a dashboard in the hotline team. The nurses can see that an e-PROM's come through. Patient X is reporting these symptoms. So before the nurse calls the patient, they can actually go into the medical records, start to have a look at who the patient is, what their history is. Then they can call the patient and say, right, I've seen your e-PROMs, I've looked at your medical records, and start to do a more in-depth, faster consultation with the patient. So just to demonstrate, it's been really, really popular with the patients. This is just an example of one of the service evaluations that we've done with head and neck and lung patients. And remember, these patients usually come from backgrounds where electronic mechanisms may not always be very popular with this patient group for socio-demographical reasons, but we've actually found that that these patients have really picked up e-PROMs and have found it to be really, really helpful to their person-centered care. Reasons for not completing, there's nothing here that would surprise you. Some patients don't have internet access, etc., but we're finding that as the years go on, that is getting less and less, and most people do have access to a smartphone and the internet. So in summary, e-PROMs is now an integral part of cancer care at the Christie Hospital. They're really convenient. It really adds to the patient and clinician communication within that consultation. It's really starting to transform the treatment pathways at the Christie now and across the Northwest. But what's really important to success with a program like this, it's not only the patient buy-in, but it's the clinician buy-in as well. And, you know, we did come up against quite a few blocks very early on, and we had to work very hard to bring clinicians on board with this program. But it's been very successful. And as you can see, there's more disease groups now that have access to e-PROMs than groups that don't. So just to finish off, you know, as I've said, this program of work is really about transforming patient care, improving patient outcomes, improving patient experience. But, you know, my goodness, we've got such a wealth of data now, real world data, that we can start to look at pragmatic trials, personalized treatments, and excitingly start to do some AI and integrate the e-PROMs data with the clinical data, because it's all sitting in the one place. It's all sitting within the electronic health record system. And I'm just going to finish with saying that we've run lots of awards for this, and we won the Northwest Innovation Award. Unfortunately, I'm not in the picture because I was home with COVID at that time. But thank you very much for your time.